Hi, I'm Dr. Rachel Langley, not calling, I'm making a video from Pine Ridge Family Medicine here in beautiful Colorado Springs. If you've been following my pregnancy progress, I'm currently 33 weeks. Yep, still have a belly. And this happens to be my fifth baby that I'm delivering, my fifth child, and I have happened to breastfeed them all. It was a lot tougher for the first one and then a lot easier for most of the others. And because of my difficulties, especially with my first baby, I became a lactation consultant as well as a family medicine doctor so that I could help my patients better with that and help volunteer as a Latch leader as well. So this is something that I'm into and I do. I have been definitely called mean things when it comes to lactation before, but I believe strongly that I'm not here to push anyone to breastfeed at all, but there's a lot of families out there that want to breastfeed and they don't get the support that they need. So that's my goal in life, is to help people to reach their breastfeeding goals. Not goal in life, but goal with lactation. And so that's what this video is about. I realized that especially with coronavirus that there's not as many classes going on in person, and those are the best places to learn from all sorts of different moms. Just hearing different experiences is the way that you form your best ideas, I think, when it comes to parenting. Because a lot of parenting, every single child, every single, especially month of life when they're little, it gets a little bit less changeable as they get older. But every week seems different with a newborn. Just because sleep is going well this week doesn't mean sleep will be going well next week, at least in my experience. So being able to hear lots and lots of different ideas from different moms, from different dads, from different walks of life on how to cope with these different stages of raising children is super helpful. That whole village raising a child, I think in part is just to get ideas from other people who have been there and to get lots of different ideas, because just the first idea that you're going to hear is probably not going to be the one that works for your family, but maybe the next one or the next one or the next one or the next one will. So it's a shame that we don't have those in-person support meetings right now. There's a lot going on online, and I encourage you to check those out. I mean, even though it's just on Zoom and you're still in your living room, it can still be beneficial. You still get to hear those ideas on parenting from other parents out there. So those can be really good. If you have a specific question, you can ask those specific questions or call one of the hotlines, the warm lines of breastfeeding support out there as well. But this is my attempt to make a series of classes of what I wish that all families that were looking into breastfeeding could hear before they deliver. They are very similar to meetings that I've led in person before, and it's not quite the same because usually I'd ask a lot of questions and we'd go around the room answering the question to hear from everyone's perspective. So you are definitely missing out on that to just have this class instead, but it's also better than nothing. And I continue to encourage you to check out those Zoom meetings, or if it's past the time of COVID and you can meet in person, phenomenal. Go to those support groups. That will not only give you information, but also give you friends, maybe even lifetime friends of other people that have been where you are and you can relate to and you click with. And after going through the difficulties of raising a young child, that can really bring you together for a long time. So cool place to go. So when it comes to, my first video was talking more about the benefits of breastfeeding, why you would want to breastfeed. I'll see if I can put a link to it there. And there's a lot of benefits out there. I obviously think there's more benefits to breastfeeding than to formula feeding, because that's what I chose for my kids. But there's definitely situations in which I can imagine that not being the case. So I assume that you're here, you're choosing to breastfeed or want to breastfeed, and you're kind of nervous about that, maybe because it's your first baby, so you have no idea what it's going to be like. So how do you get off to the best possible start? You've been sold at least that you want to try. Awesome. That's all we can really ask for, especially in the early days with my first baby. It was all about short-term goals. It was not a goal to breastfeed her for years and years and years. It was a goal to get through this week if I could, or on a bad day to get through today. And that's one piece of advice that I've heard over and over that can be really helpful, is to not quit breastfeeding on a bad day. That we all have bad days. And especially if this was a goal of yours, don't choose that day to quit. Wait until you can think a little bit more clearly, when you're not quite so despairing about how difficult things are. and wait for a better day and see if that's still what you want to do, which is fine. Any degree of breastfeeding is great. If it's one feeding ever, awesome. You succeeded in breastfeeding your baby. If you breastfeed for months, awesome. You succeeded in breastfeeding your baby. If you breastfeed for years, awesome. You succeeded in breastfeeding your baby. Any kind of breast milk that can get in is great, and we just want to keep moms and babies healthy. That's our goal as healthcare professionals. So you're preparing for this first baby. What do you need to concentrate on? So 3 big areas: information about what to expect, what a proper latch looks like, things like that. Having a birth plan. I've had lots of patients and friends that have had less than stellar births, not what they wanted. It was really rough. Lots of bad things happened, and they were still able to breastfeed successfully. So you can have a plan, but the best laid plans sometimes don't go right. So keep that in mind. But you can have an idea of, this would be cool if this happened when I deliver. And then the basics of how to start looking into what are the basics of breastfeeding. Watch more of these videos. Start reading books. Some of my favorite books. I really am a sucker for the Latch Womanly Art of Breastfeeding book, available on Amazon or lots of local bookstores. And I feel like that has so many fun stories that make it fun to read from moms that have been there and done that. And some of those stories have stuck with me for life, and I can still look back and be like, I love that story. I can really relate to that. And if you happen to be in the military, as I have been for 3 of my deliveries, kind of 4, mostly, definitely 3. I really like breastfeeding in combat boots, and that has a lot of the nitty gritty of what life is like in the military while trying to breastfeed and succeeding in breastfeeding, hopefully. So start reading that information. Start looking online for what a good latch looks like. There's a lot of more skeezy reasons to be on the internet than to be looking at latches and seeing what lactation consultants look for in a good latch. I mean, the basic criteria to me is always, is it comfortable for mom, and is baby transferring milk and gaining weight? And if things don't look right, but those 2 things are happening, I don't know if I care about much more details about the latch, if the lips are flanged just right around the breast, or if it's a perfectly asymmetrical latch around the areola. Those are some things you'll most likely encounter. But I definitely have seen moms that everything looks perfect and they're still having pain, and that's a problem. And I've definitely had couples that the baby wasn't gaining weight, wasn't transferring milk very well, but everything looked perfect and seemed comfortable, and that's still a problem. So that's what it comes down to me when it comes to latch. So keep that in mind as you're learning about the latch. Those can be helpful hints pointing you in the direction of a comfortable latch that can transfer milk well for baby. But that doesn't mean that it's perfect in every way. Other information that you're going to be probably overwhelmed with is how much equipment people say that you need to breastfeed. Do you really need all the right shirts and all the right bras and all the right furniture and this glider and this kind of pump, or maybe that kind of pump, or maybe both kinds of pump and this pump just to be safe? There's a lot to look into that. And I want to remind you that people have been breastfeeding their babies for thousands of years and haven't had any of that equipment, and they did just fine. So a lot of that are bells and whistles. I mean, even for going to work, it is possible to express your milk by hand without a pump, and it's actually pretty efficient. Your hands are going to get really strong or really tired and then strong from expressing that breast milk, but it's definitely possible. You can't do anything else while you're hand expressing as opposed to with a pump. So that's the real convenience of the pump, is that after you get started, sometimes you can take your hands away and be doing other things. But at least in my experience, most of the time when I'm pumping at work, I don't have a phenomenal supply. So I have to do what's called hands-on pumping, or a massage during pumping to make sure that I'm getting all the milk that I can. Stanford University has a fantastic video on what that is. If you Google Stanford University hands-on pumping, that can be a good thing to do. But there's a lot of information out there about the pros and cons of this and that and the other thing. Pretty much, to me, all double electric pumps are equal when it comes to returning to work after a couple weeks to months after baby is delivered, and they're all pretty good. I like some of them more because you can recycle them. I like some of them more because they're dual voltage, and when I've been overseas, that's been useful to be able to plug into wherever I am. So that's information. Whew, that was a lot. Take a deep breath. Okay, birth plan. There's a lot of schools of thought of the best way to establish breastfeeding after delivery. It does seem that having a golden hour with baby skin to skin with you, whether you've had a C-section or a vaginal delivery, is the best way to exchange hormones and just intangible information with your baby that helps you to establish your milk supply in ways that we don't necessarily understand. So that means that just setting baby on your chest after you've delivered and baby's naked, maybe has a diaper on, and you're topless, and you got a blanket over the two of you, and you hang out for an hour. I think the only time that that has happened with me was my last delivery, my fourth baby. And I got kind of bored actually because he latched on so well and we breastfed for a long time. And then I was like, I'm hungry. Let's move on. I mean, I know the criteria is an hour, but I think we've checked off the getting breastfeeding established, and I'm really, really hungry after that delivery. Um, but that's a really good thing. And they say after C-sections, that it might even take 2 hours to really have that perfect establishment of that kind of bonding that helps for some reason with breastfeeding. And keep in mind that that milk that you're giving to baby in those early hours is called colostrum, and it's much thicker than your full mature breast milk. It's not going to look like much. Baby's stomach is pretty small, so it doesn't need all that much to be full, but baby does need to feed very frequently. So in those early days, I wouldn't go longer than about 2 hours between feeds to make sure that you're establishing breast milk well. Other things in the birth plan, I've seen breastfeeding go both ways for natural births, go easy or hard for natural births without any pain medication. I've seen it go hard or easy for C-section moms and everything in between. Epidurals are very common. Pain medication is very common in delivery. And just be aware that sometimes those might get in, especially if you get an earlier epidural. Maybe it makes baby a little bit more sleepy. So spending more time with baby after delivery and working on the latch and working on just being together might be required with those kinds of interventions. And that's fine. Lots of moms succeed in breastfeeding. But looking into that information about what your birth plan looks like, how that could impact breastfeeding. If breastfeeding is something you want to do, then you need to keep that in mind with your birth plan as well. And make sure that, for example, if you're going back for a C-section, that your anesthesiologist and your surgeon are aware that you'd like to have baby on your chest as soon as possible. Sometimes that can happen in the delivery room, which is awesome. But more often it happens in the recovery room, and that can still be awesome for establishing that first breastfeeding. So birth plan, yeah, good stuff. And then basics of how to. So this is where it gets into kind of life after your delivery. It's hard to imagine when you don't have kids how hard it is to even comprehend going to the grocery store with a newborn. So hearing, especially from other parents, about how they actually do that with this squirmy, crying infant that wants to nurse at unexpected times or have diapers at unexpected times, and you might have a full grocery cart and all of a sudden you need to find some place to sit down and nurse. How do you actually do that? These are things that you probably haven't paid attention to before in life. But that's something that parents are doing every day all around you. So asking them questions. And I just have a whole list of places, things I recommend, like how do you shower? You've got this baby that wants to be held all the time, and sometimes you can get them down for a nap, but sometimes that's just not happening. So how do you take a shower when you're that smelly and miserable, and you might even have little bits of milk all over you that is starting to smell kind of funny? A shower can really refresh your outlook on life in those early days. So how does that happen, especially if your partner has to go back to work? How do you, I remember going to the airport with a 3-month-old and traveling by myself, wondering how I was supposed to carry all this stuff. I had a big bag of baby supplies and another bag of snacks and a stroller and a baby carrier, and it was really tricky to navigate. But I remember finally getting it down and walking through the Washington Reagan airport with my baby in a sling. And I actually was able to arrange things so I was able to nurse while I was walking around and just have one hand on baby and one hand doing stuff. And I bought a sandwich and paid for it. And I don't think they guessed that I was nursing a baby that whole time with my first little 3-month-old. And I was so proud of myself. So learning tricks like that and giving yourself time and patience to figure them out is going to be one of the big deals of getting used to having a baby, getting used to having kids. And other things, how do you go clothes shopping with a baby who wants to be up all the time? How do you cook dinner? How do you get your hair done? How do you have time alone with your partner? How do you drive with a baby crying in your back seat all the time? How do you go get to a restaurant for a date with your partner? How do you go to a public restroom? How do you sleep? How do you take care of older kids? There's just so many things. And so ask. And the best thing is to have multiple opinions. There's no single answer out there that's correct. That's why I can't give you an answer today in this video. But I do want to encourage you to ask those kinds of questions to the parents in your life. And then there's the other topic of, okay, what if you're not spending all day every day with a baby? There's other complications in that too. How do you leave your baby at daycare for the first time? How do you pump? I have another video on that I'll try to post right there if it lets me. Excuse me. Returning to work and pumping. How does your heart not break every time you leave your baby at daycare? How do you make sure that you keep up your milk supply being away from baby so much? Tough things to look into and think about, and it won't really make sense to you until you're there, but that's okay. You can be thinking about it in the meantime. So thanks for watching. I hope that this gets you a little bit thinking, wondering about questions you should ask people, sending a list to people. In addition, I've gotten so many questions of how many baby supplies do I actually need? Do I need this many burp cloths? Do I need to have this brand of stroller? And maybe if you're sending those kinds of emails out, ask these kinds of questions as well. It's a tough time if you're delivering a baby during coronavirus time. It's hard enough having a new baby in normal times, and this is an extra difficult time. And I'm right there with you. Gonna go deliver in about 7 weeks. Good times. And I hope you enjoyed this video. Here's another series of videos that you might benefit from when it comes to breastfeeding. And then if you wouldn't mind subscribing to our channel right there, that would notify you when we come out with new videos. Thanks for watching.